Here we will discuss about seizure. Seizures are episodes of abnormal motor, sensory, autonomic or psychic activity or a combination of these resulting from sudden excessive discharge of cerebral neurons. So when there is a sudden excessive electrical discharge from neurons, it will cause some type of motor, abnormal motor or sensory or psychic activities. This is called as seizure. Actually, the underlying cause is an electrical disturbance in the nerve cells. As you know, there is a electrical potential in our nerve cells. So sometime what will happen, there will be an abnormal or uncontrolled recurring electrical discharge. So this abnormal or uncontrolled electrical discharge will cause some type of abnormal activity, or maybe motor, maybe sensory, or maybe psychic activity in a patient or in a person. This is called as seizure. Causes of seizures, there are a lot of causes: genetic, then developmental defects, hypoxemia, fever in children, fever may cause seizure, then head injury, hypertension, central nerve system infections like meningitis, etc., then renal failure, hyponatremia, hypocalcemia, hypoglycemia, brain tumor, drug and alcohol withdrawal. So all these causes will cause some type of abnormal electrical discharge in our neurons, especially in the brain neuron. So this will cause seizure. Types of seizure. Partial seizure. Partial seizure is again divided into simple partial seizure and complex partial seizure. Then generalized seizure. This is again divided into tonic-clonic seizure, or tonic seizure, clonic seizure, absent seizures, atonic seizures, myoclonic seizures. We will discuss or explain about these different types later when we will discuss about the clinical features. So mainly there are two types, partial seizure and generalized seizure. These seizures again divided into different categories. Management during a seizure. If we get a patient with a seizure, the management is the patient to floor if possible. So if possible, we have to place the patient on a floor or on a bed. Protect the head with a pad to prevent injury. So you have to protect the head because seizure will cause a lot of agitated activity, then patient may get some injury. So you have to protect the head. Then loosen constructive clothing. Then do not attempt to open jaws to insert anything. So do not open or try to open patient mouth or anything, or put anything inside patient mouth to avoid something. So because it will cause a lot of problems. So do not attempt to open jaws. In some patients we may get an idea or signal that patient is going to get seizure. So in that case, like in some patients, there will be aura means it's a warning sign. Before seizure happens, there will be a warning sign, that is called aura. In that case, if you want, you can insert something into patient's mouth to avoid tongue bite, etc. But normally if you see a patient with a seizure, don't attempt to open patient mouth. Then no attempt should be made to restrain the patient during seizure. Do not restrain the patient or do not suppress patient's activities or anything. Let the patient be free that time. Do not attempt to restrain the patient. If possible, place the patient on one side with the head flexed forward. So you can place the patient on one side with the head flexed, because it will help to avoid the tongue block. Then it will also avoid aspiration of secretions, because this time patient will make lot of secretions, so it may aspirate. So what we can do, place the patient on one side with the head flexed so that the secretions will go freely from patient mouth. If suction is available, then you can do the suction. Then keep the patient on one side to prevent aspiration. Then make sure the airway is patent. Always check the patient's airway that it is patent. So this is the management during a seizure we can do. Next, discuss about epilepsy. Epilepsy is a group of syndrome characterized by recurring seizure. So if patient is getting seizure frequently or recurrently, it is called epilepsy. Like if patient is getting seizure many times, it is called epilepsy. This is a group of syndrome. It is characterized by recurring or repeated seizures. Clinical features. Partial seizure. Before I discuss about the partial and generalized seizure, here now we will discuss about these clinical features in detail. Partial seizures means it affects only part of the brain. So this seizure is affecting only one part of the brain. Again, partial seizure is divided into simple partial seizure and complex partial seizure. In simple partial seizure, only a finger or a hand may shake. So you can see a hand or a finger will shake, or sometimes the mouth may jerk uncontrollably. The person may experience unusual or unpleasant sight, sound, smell or taste, but without loss of consciousness. So in this simple partial seizure, only a finger or a hand or mouth will have jerking movement, and patients sometimes tell they hear some type of sounds, sometimes they will see some sight, or sometimes they will get a special smell or taste, but patient will not lose consciousness. That is important, patient without loss of consciousness. But when it comes to complex partial seizure, person either remains motionless or moves automatically. Here patient will move, sometime without any movement, and patient will not understand or disoriented about time, place, person, etc. And patient may experience excessive emotions of fear, anger, elation or irritability. So there will be a lot of excessive emotion or fear or anger problems. Then person does not remember the episode. Even if you ask about these things, patient will tell that he or she doesn't remember about this seizure attack. That is complex partial seizure. When it comes to generalized seizure, it involves both hemisphere of the brain. So in partial seizure, only one part of the brain is affected. But in generalized seizure, which is otherwise called as grand mal seizure, in this it involves both hemisphere of the brain. Both hemisphere will involve, and it will cause both side of the body to react. So here both side of the body will react, or there will be movement on the both side of the body. In partial seizure, I told only a finger or a hand may shake, but here both side of the body will shake. Alternative muscle relaxation and contraction, which means generalized tonic and clonic. Clonic contraction. Tonic, clonic contraction means alternative muscle will relax, then contraction will be there. There will be relaxation and contraction of the muscle. That is tonic, clonic contraction. Then the tongue is often chewed. Tongue bite will be there. Then patient may pass urine or stool. Incontinence of urine and stool will be there. Then patient may go for coma. In some patient, after seizure, patient will go for sleep or deep coma, etc. for 1 hour or 2 hour, like that. So this is generalized seizure. It is otherwise called as grand mal seizure. Regarding medications, carbamazepine, clonazepam, gabapentin, lamotrigine, oxcarbazepine, then phenobarbital, phenytoin, primidone. These are some of the medications which we use for seizure or epileptic patient. Gingival hyperplasia. Remember, gingival hyperplasia means swollen and tender gums. Gingival hyperplasia can be associated with long-time use of phenytoin. So one of the side effects of phenytoin is gingival hyperplasia. This is important point. It may ask for the exam. Gingival hyperplasia can be associated with long-time use of phenytoin. Thank you.